The study is called Aurorax 87A. That's the long name of it. We just call it AUR87. And what it's about is a diagnostic test using a urine test to measure something called glycosaminoglycans, GAGs for short. And then if you look at different profiles of GAGs, which are long sugar chains, you might say, or disaccharides, polydisaccharides, we measure the profiles of those in urine to see if we can detect a recurrence from clear cell renal cancer. And the way we do the measurement is that it's a mass spectrometry machine that measures the different profiles of different GAGomes, and that's then calculated into a GAGome score. That GAGome score, the intention of the study was to determine whether the GAGome score could give us a new diagnostic tool to detect recurrence after curative intent surgery for clear cell RCC. The way the study was set up was that we had a prospective multicenter study, so with two-step design, meaning that we had one cohort to develop the GAGome score test, and then a second cohort is intended to validate our initial findings. So identical cohorts, identical setup of the studies, but what is being presented is the cohort 1 data that came out now. And what we did was that we followed patients who had curative intent surgery for clear cell RCC specifically. And with curative intent, we mean, of course, either partial or radical nephrectomy. And if the patient was without any signs of disease at our final eligibility assessment, they were included in the study where they were followed with the regular standard of care imaging as their surveillance protocol. And alongside that, we took on a regular basis urine samples to measure the GAGomes and then calculate the GAGome score. The study started in January 2020, and the last patient visit was in 2023. We then analyzed the data, and in the 134 patients that were enrolled in the study, we could see that about 16% had a recurrence. And when we looked at the diagnostic accuracy of the GAGome score to detect a recurrence compared to the reference standard, which was imaging, we found that the sensitivity for GAGome score is 90% and the specificity is 51%. And that gives a negative predictive value of 97% to rule out a recurrence using this urine test. And it gives a positive predictive value of 26%. So this test was really good at ruling out cancer, but moderate to rule in or detect a cancer. What we also showed that for every 10 points on the GAGome score, which is it's a calculated score of between 0 and 100, if you put the threshold at 12 points, that was the optimized cutoff point for getting the sensitivity and specificity data I just provided. At that point, for every 10 points increase above that, the risk of having a recurrence went up with 63%. Lastly, we also saw that if you compared the GAGome score as a method of detecting recurrence to the standard of reference imaging, the lead time was 4 months, meaning that at the median level, the GAGome score could detect recurrence 4 months earlier than radiological recurrence. So our conclusions of the study are that the test has a high sensitivity, but a moderate specificity, and that translates into that you can use the test to rule out cancer, And if you look at the lead time, you can actually then conclude that clinically you could omit half of the CT scans that are being performed today. So that would reduce costs for the healthcare systems. It would reduce anxiety for the patients having to do frequent scans, and it would allow earlier recurrence detection, potentially. The limitations of the study was that the follow-up was only 18 months, so that might have biased the specificity and also the lead time. Lastly, as a next step, we're going to perform the analysis of cohort 2, where the patient enrollment and the last patient visit is going to be towards the end of this spring of 2025. And we'll hopefully have an external validation data set to confirm our findings in about a year from now. The GAGome test and the company that has developed it, the sponsors of the study, they have not received regulatory approval for the test, so it's not on the market yet, but they aim to have it on the market in 2026.